Welcome back. With us live over the phone for this topic is our prominent guest, Dr. Islam Anan. He is a lecturer of health policies and health economics and also consultant to the Minister of Health. Good morning, Dr. Anan.
Good morning to your audience.
How are you doing, sir? So how do you weigh the state's current efforts to improve accessibility and quality of healthcare services in Egypt?
If we start, let's start with budgets. So, for example, over the past decades, the healthcare sector budget has increased maybe more than fourfold. So, increasing budget, that was the first step. It would like to enhance two things, which is the vision of Egypt in 2030 for health, which is access and equity. We would like to have an equitable access for all Egyptian citizens to healthcare facilities. And secondly, we would like to have equity in terms of health for all Egyptians. We are not targeting just building hospitals, just providing medical treatment or medical equipment, however, providing health, which is a higher and a better aim than just providing healthcare facilities. The aim of providing health, which from that subsides the presidential initiatives, for example, which is how to make preventive medicine, how to make preventive campaigns to prevent healthy citizens from becoming ill or becoming with a disease that we need to treat later on. Hence, for example, emerged the 100 million healthy lives and the eradication plan for hepatitis C, which was a huge step in our healthcare and a leap in healthcare, where we screened around 60 million Egyptians for hepatitis C and for non-communicable diseases. Another thing, for example, in terms of access and in terms of leap, is the amount and the number of healthcare units that were developed nationwide over 14 government rates in the last decades. We are talking about 3,500 new healthcare units. And in terms of services as well as waiting lists, the elimination of waiting lists was, and I believe, one of the most prominent initiatives in Egypt and in Africa, because the presidential initiative made the effort for 2.5 million Egyptian citizens to receive their surgery or their medical intervention, and within a turnaround time of around 1 month to 2 months, where this waiting list, for example, in the other countries and even in Europe, can go up to 12 months and sometimes 24 months, and that's a huge success.
Right, so assessing this very successful, popular initiative, 100 million lives that have achieved a lot until now over the years, medical services to all sectors of Egyptian society. The importance of 100 million lives initiative and boosting medical services to all citizens, raising the awareness, alleviating even the quality of health and life over different sectors, the elderly, the youth, the toddlers, women, you name it. So give us an overall assessment, though that we have done that many times, but we keep rejoicing our successes for that particular successful campaign.
Yes, and that's right. We need to celebrate it because it's actually a huge success and it's a continuous one. And with a sustainability plan as well, we are talking about 14 presidential initiatives that goes through the life journey of Egyptians. As you mentioned in the very important question, it starts with pregnant women, the follow-up of pregnant women for viral diseases, till the newborn screening, where we screen all infants in the ICU for 19 genetic diseases, till the hearing presidential initiative to make sure that the newborns got nothing wrong in their hearing. And then when they enter the school, we do have the school initiatives, whether we are talking about the nutrition plan and the school meals, or the obesity, stunting, and anemia presidential initiative, where we screen every year around 10 million school students for anemia, stunting, and obesity, and then refer to the health insurance organization. And then the non-communicable diseases, which is another life journey for diabetes, hypertension, and cardiovascular diseases. And then we do have the cancer, for example, campaigns where we are actually including 6 types of cancers. One of them is actually breast cancer, where in women's health, it was, again, it's like the hepatitis C, a huge success. Egypt managed to make another Guinness record with screening of 30 million Egyptian females, Egyptian women, for breast cancer. And we identified 30,000 breast cancer cases, and 60% of them were actually in earlier phases. And when you discover breast cancer in early phase, it's a curable one. Usually, before that campaign, before 2018, we were discovering most of the cases in late stages. Late stages, unfortunately, led to death. And then it continues to the elderly. We do have the senior citizen presidential initiative as well, and geriatric. Till the 14th presidential initiative that was launched this year, which is mental health and wellness. And this is very important. Now we are talking about another phase of presidential initiative. We're talking about how to maintain good mental health, good wellness for Egyptians, so we can prevent a lot of diseases that actually emerges from poor mental health and wellness. Like, for example, depression. We would like to make sure that we are avoiding medical depression, general anxiety disorder. And then there is another one for autism, to make sure that how we are actually managing autistic children, and train even for free their parents or their caregivers how to handle them and how to make sure that they are continuing their education. And it continues over and over. And this will not going to be the last presidential initiative. The presidential initiatives will continue providing health till we are actually reaching 2032 and making sure that the new health insurance is prominent all over all governorates of Egypt. And then we are promoting health and not just providing healthcare services to ill people.
Right. It's very important what you just raised, Dr. Anan, which is the addressing new types and of difficulties, medical difficulties or health difficulties or psychological difficulties that weren't addressed before in history of health programs like depression, like autism, like dyslexia, like other learning and cognitive difficulties for kids that come as hinder their advance. Those are normal kids. They deserve attention. They deserve assistance. But usually, before this initiative, society considered those types of difficulties like something that could be considered as abnormal. And that was treated or considered as, they would corner them in schools. So how did that change the face of education, the face of integrating those kids in society and presenting them to society to be active members, to be the future successes because they are talented and successful?
Yes,
like
I totally agree, because we were treating autism from some schools or from institutions as if it's a stigma for the family. And where there is an autistic child in the family, there is a big stigma whether I will be able to put him in school, whether I will be able to make an inclusion with the other children, and whether the school will accept an autistic child. And we are not talking about autism only, we are talking about the spectrum, the whole spectrum of autism.
Right.
Even if they got a small spectrum, sometimes they are refused to be enrolled in some schools. And the main objective of the initiative is to make sure that we are erasing the stigma and make sure that there is an inclusion. We need to educate and raise the awareness for schools, for the community, that autistic or the spectrum of autism is actually a normal kid with a condition, but we need to know how to deal with him or with her. We need to understand the full knowledge or the full science behind the spectrum of autism. And we need to make sure, and this is very important, to educate the mothers and fathers how to handle them. Sometimes the parents are putting their children under a lot of stress to be able to compete or to be like other kids. He's not like other kids. He's normal, but in his own way. And this is a very important challenge. The Egyptian Ministry of Health, under the Trust of Mental Health, they made a very nice program to educate parents, and it's a dedicated 3 months free of charge program for any parents who got an autistic or a spectrum of autism child to go there and take the training to make sure that they are capable of handling the concerns, handling his daily routine, and making sure that he is in the right school and he is in the right place to continue his education and continue his normal life. He got a normal life if we can actually put him in the right pathway.
Right. Do you agree or not, if you can correct me, like in the case or in the sense of certain missions for this campaign 100 or this initiative, very successful initiative, 100 million lives, required different types of services, like those difficulties that you talked about, or those targets that were handled lately by the initiative, like autism, like depression, like cognitive and difficulty in learning, require more of an awareness campaign and educational campaign to school staff, to family members, to society, to whoever who might be concerned, even to children themselves, rather than medication. I mean before medication, together with medication. So if you like to elaborate also on the importance of that particular...
That's correct, that's correct. We are talking about management, and management is not necessarily a medication. So we actually divided into two things. The management should be counseling if the disease itself needs counseling. For example, it's a medical depression, but we are still in the phase of not needing a pharmacological medications, we need a counseling. And hence, the Presidential Initiative for Mental Health, Happiness in Your Health, I think this is the slogan, they make free counseling for addiction, for depression, for anxiety, and for autism, as we mentioned, because this is a starting point. Sometimes we cannot ignore the pharmacological medications. However, we need to make sure that we are following a scientific scheme who exactly will be needing the pharmacological medication and who will not going to be needing that. Because not any member of the society to mention that I got depression now, you need the medication. Sometimes it's a transient thing, sometimes it's a mood swing. Who can actually diagnose or make sure that it's a mood swing or it's a general anxiety disorder or a depression that needs a medication? Only a specialist. Hence, the counseling is very important to make sure that we know the root cause, and hence the diagnostics is very important to make sure is there any change in the chemistry of the brain, or just it's a social thing or it's a psychological thing that he doesn't feel well these times. And you mentioned a very important point, because recently we've noticed that a lot of people who just feel some anxiety, who just feel some stress, they go for medication, and this is a very important point to avoid, because once you are entering a medication, this is a step that needs a very cautious measures. We cannot just start any medication on our own. We cannot just stop it on our own because we do have a withdrawal symptoms. A very good specialist, and here I insist on saying the very best specialists in psychological and psychiatric care are inside the Ministry of Health. They do the job free of charge. They don't need any visita, for example, so they are actually devoted for the science itself. They are scientists. And hence, the full trust are in this campaign, and we can notice that there's a waiting list by thousands of Egyptians to take the free counseling and enter the program itself. Currently, we finished the training, a lot of training. We are talking about 2,000 trainees took the training for autism, for example, and for psychiatric conditions inside the Ministry of Health, whether, as you mentioned, education for the parents or even for the general public.
Right, amazing. Of course, best of luck, Dr. Islam Anan. You are a lecturer of health policies and health economics, and also a consultant to the Minister of Health. Thank you so much talking to us on the Breakfast Show, and wishing you a good day. By this, we come to the end of this edition of the Breakfast Show for today. Many thanks to all of you. Till we see you again tomorrow morning. That's a goodbye.